Hi everybody, it's Angie with Bellissimo. I'm one of the nurse practitioners. Today, this fine lady here came in for a Helix treatment. And so upcoming and new, we targeted some laxity, also pigmentation. We also did the full face and then also the neck. And so a lot of people come in to do lasering and they're really concerned. What do I expect? What's my downtime? Am I gonna have any pain? So what we did, she came in today and we did some photos, of course, beforehand. And then we also did the glimpse, and that way we can analyze the whole face to include even the sides, chin. So we're looking for browns, reds, and any type of possible aging that could happen. And then we even touch the forehead and the cheeks, and that tells us if we have good moisture in our skin. So we did that beforehand. We did our consent, and then we did numbing. So tell me about the numbing. What did you think of that? What was it?
It was just a lotion placed all over my skin, very soothing. I loved it.
Good. And so that usually lasts for about 15 to 20 minutes. And again, we're in and out. We're checking on you frequently, seeing if you need anything. And so once the numbing is done for about 15 to 20 minutes, we go ahead and wipe that off. We use a Puricin and alcohol. That way we're cleansing the skin one more time before we start the treatment. And so tell me what you thought of the treatment.
Not bad at all. I didn't know what to expect.
Good.
I felt some tingling.
Okay.
I could feel some pressure from your hands on my face. Nothing like I thought. I would do it again in a minute.
Good to hear. So the machine behind me is the Helix. It has a cooling pad on it. And so that cooling pad, as we do each pass, it cools the next pass. And then we also use another machine that blows cooler air, and we're able to target even more. So did you think you felt uncomfortable, too hot, too pinchy? How would you describe when we did the passes? How would you describe that?
I could feel tingling. Every now and then I could feel a slight pinch. Nothing at all that I would even move or react to.
What part of your face do you think was the most sensitive?
I would say along the lip line.
Okay.
And a little bit on the nose. Everything else, the neck, I felt nothing.
Okay, good. So the Helix itself can take anywhere between 30 to 40 minutes, depending on what area we're doing. So if it's just face, it might be a little less. If we're treating the neck, that adds more time, and then also the décolleté, so chest. Those are all options, but today we just did the face and the neck. And so afterwards, this is immediately after the laser, we put some moisturizing lotion on, and she's gonna keep this moisturized very well for the next 72 hours. The biggest thing with this is avoiding the sun, no direct sunlight, and large brim hat and sunglasses when you're outside. To do this, we would meet with either Dr. Antimarino, myself, or Amanda, our physician assistant, and they'll go through a whole analysis of your skin, what you're eligible for when it comes down to what laser works best for you, and it also has to fit into what's going on outside of the office. What else would you tell anyone?
Everyone made me feel very comfortable. Everyone was very nice. I loved the air being blown on me the entire time. I felt like a princess.
Well, thank you. We appreciate it.